Hi friends, welcome to the channel The Nurse. Here we are discussing about maternal and child health care, nursing questions and answers. If you are not subscribed to our channel, please subscribe and it will be helpful for preparing upcoming JIPMAR ESIC exams. So we will go to our topic, maternal and child care health nursing. First question, which of the following is not included in 5 claims in conduct of delivery? Clean hands, clean perineum, clean cutting and care of cords, clean surface for delivery. 5 cleans it is used to prevent neonatal tetanus. So which one is not included? So here correct answer is clean perineum. So we will discuss the details here. 5 cleans under strategies for elimination of neonatal tetanus includes clean surface for delivery, clean hands of birth attendants, clean cord cut, that is with either blade or instrument, clean cord tie, and fifth one, clean cord stem. That is no need for applying any ointment or anything. So we should keep the cord stem as a clean and dry. Next question. All are criteria for identifying at-risk infants except birth weight less than 2.8 kg, birth order 5 or more, protein energy malnutrition, and diarrhea, working woman. Correct answer, birth weight less than 2.8 kg. So actually it was birth weight less than 2.5 kg instead of 2.8. The at-risk infants includes the birth weight less than 2.5 kg. That is the correct answer. So we will go to the criteria. Before that, at-risk infants. What is the need for understanding at-risk infants, or what are the importance of at-risk infants? That is, central purpose is to identify high-risk cases as early as possible. So we need to find out the at-risk cases at early as possible from large group of all antenatal mothers and infants, and provide specialized care to them while continuing to provide appropriate care to all antenatal mothers and infants. So at-risk infants importance means we can find out the high-risk cases and we can start early treatment to prevent the complications. So that is the main objective. So basic criteria for identifying these babies at-risk infants includes: first one, birth weight less than 2.5 kg. In question, it is mentioned 2.8 kg. That is why it is a exceptional case. So next thing is birth order. If the baby is as a fifth child or more, then it is a high risk infant. Then artificial feeding. The baby is receiving artificial feeding, that baby also will be a high risk case, because the antibodies from the mother, it will not be available in artificial feeding if you are giving artificial feed. So antibodies will get from mother breast milk only. So then only the baby will be able to prevent the infections. So weight less than 70% of expected. That is second and third degrees of malnutrition. So underweight babies also it is a high risk category only. Then failure to thrive. Failure to thrive means failure to gain weight in 3 successive months. So first any 3 successive months, baby is not able to gain the weight. Baby's weight is not increasing according to the age in 3 consecutive months. That also an indication for high risk cases. Then children with protein energy malnutrition with and diarrhea. And the next thing, working mother and single parent. They are also categorized under high risk category. So the baby from a working mother or single parent is also categorized under high risk cases. So next question, The term used for babies born as a result of retarded intrauterine fetal growth is. The term used for babies born as a result of retarded intrauterine fetal growth is preterm babies, low birth weight babies, small for date babies, retarded babies. Correct answer is small for date babies. So we can understand the categorization. First, babies according to gestational age. First one is preterm babies. The baby born before 37 weeks or before 259 days after LMP. Less than 259 days means the babies also called preterm babies. Term babies means the babies born between 37 to 42 weeks or 259 days to 293 days. So during that period, the baby is known as term baby. And post-term baby, when baby is born after 42 weeks or more than 294 days, it is called post-term babies. So I think it is clear. This is a classification under based on gestational age. Then low birth weight baby. Low birth weight baby, when it is called, means the baby's weight less than 2500 gram or 2.5 kilogram irrespective of gestational age. Even if it is preterm baby or a post-term baby, baby's weight less than 2.5 kg means it is called low birth weight baby. Then another classification, small for date babies, that is born at term or post-term baby. That weight that is less than 10th percentile for gestational age. When compared to that other categories baby, if baby is born on the 37 week, then what is a normal? It will compare to the normal weight of the 37 weeks baby, and if it is less than 10th percentile, the baby need to get some weight at 37 weeks. If it is less than 10 percentile of that baby at 37 weeks, then it is called small for date babies. Then result of IUGR, intrauterine growth retardation. Then high risk of dying in neonatal and infancy period. These are under categorized under small for date babies. First one is weight less than 10th percentile for gestational age. So according to babies, normal baby's birth weight, if it is less than 10th percentage, it is called small for date baby, or it is a result of intrauterine growth retardation or high risk of dying in neonatal and infancy period. These are categorized under small for date babies. Then fourth question, as compared to cow's milk, human milk has more proteins, less carbohydrate, more iron, less of vitamins. Correct answer is and cow's milk also contains more electrolytes. So if you are starting cow's milk in early stage, it will cause kidney damage because of high potassium and high sodium contents in cow's milks. So we need to start as after 6 months only cow's milk during the weaning period. Then fifth question, WHO growth chart has got information for all except immunization procedures, child spacing, history of siblings, history of maternal health. Correct answer, history of maternal health. In growth chart, the history of maternal health will not be mentioned. All other things, immunization procedures, child spacing, history of siblings, etc. are mentioned in growth chart. We will discuss in detail. Growth chart or road to health chart, it is a visible display of child physical growth and development. In that, growth chart provides information on identification and registration, birth date and birth weight, chronological age, weight for age, developmental milestones, history of siblings' health, immunization procedures, introduction of supplementary foods, episodes of sickness, child spacing, reasons for special care. So these are included in road to health chart. So maternal health history will not be included in this road to health chart or growth chart. So we will go to next question. Which of the following milestones develops first? Mirror play, crawling, creeping, pincer grafts. Correct answer is mirror play. Mirror play starts approximately from 6 months onwards. Crawling, creeping, pincer grafts are starting from 9th months onwards. Mirror play milestone is seen at age around 6 months plus, and crawling, creeping, pincer grafts are seen in age about 9 months. Seventh question. Which of the following indicator is used for growth monitoring at Anganwadi center? Height for age, mid-arm circumference, weight for age, height for weight. Correct answer, weight for age. Anganwadi Center ICDS growth chart, that is, nutrition status of the child is assessed against weight for age. Separate charts maintained for girls and boys. It is mentioned as 3 zones. That normal zones includes that colored in grey, undernutrition, that is mild undernutrition, that is colored in light grey, and severe underweight below 3 standard deviation, that is mentioned in dark grey. So in Anganwadi Center ICDS growth chart, there will be 3 zones: normal zones, undernutrition zone, severe underweight zones. So each zones are mentioned in different colors: grey, light grey, and dark grey. Eighth question. The commonest morbidity in school is dental ailments, worm infestations, malnutrition, skin disease. Correct answer, dental ailments. Commonly detected morbidities in school children includes dental caries, that is seen in 180 by 180.3 per every 100 students. Same time, goiter, second more morbidity, that is goiter, that is seen in every 123 by 123.8 per 1000 students. Then third thing, that is malnutrition, that is also approximately 123.5 per each 100 students. So next question. Guthrie test is done in neonates for mass screening of. Guthrie test is done in neonates for mass screening of neonatal hypothyroidism, phenylketonuria, hemoglobinopathies, congenital hip dislocations. Correct answer is phenylketonuria. Guthrie test is done in neonates for mass screening of phenylketonuria to assess phenylketonuria. Guthrie test can detect phenylketonuria, galactosemia, and maple syrup urine disease. The chemical detected in Guthrie test includes phenylalanine, phenylpyruvate, and phenylactate. So Guthrie test, we can detect phenylalanine, phenylpyruvate, and phenylactate. So it helps in diagnosis of phenylketonuria, galactosemia, and maple syrup urine disease. Then 10th question. Most cost-effective family planning method is vasectomy, tubectomy, copper T, oral pills. Correct answer is vasectomy. Most cost-effective family planning method is vasectomy. Male sterilization or vasectomy is the most cost-effective contraceptive measure. Cost-wise ratio is 5 vasectomies is equal to 1 tubectomy. That is why it is called most cost-effective family planning method. Then 11th question, that is from next questions are from general knowledge. India has pledged to end the HIV or AIDS pandemic by which year? 2022, 2025, 2030, 2035. Correct answer 2030. At the 2016 high-level meeting at the United Nations General Assembly, India pledged to fast-track efforts towards ending HIV or AIDS as a public health threat in the next 5 years and to end the epidemic by 2030. So, at the 2016 high-level meeting at the UN General Assembly, India has pledged to end the epidemic by 2030. 12th question. Which e-commerce site platform launched a startup promotion and mentoring program named Leap? Amazon, Flipkart, Snapdeal, ShopClues. Correct answer is Flipkart. Flipkart is owned by Walmart, the American giant marketing company. Walmart is owned the Flipkart, as announced the launch of startup promotion program named Flipkart Leap. The next question. Which food aggregator platform has launched a delivery service named INSTAMART? Big Basket, Zomato, Swiggy, Dunzo. Correct answer, Swiggy. That is for instant delivery of grocery items. Swiggy has announced the INSTAMART service. Then 14th question. Which zone of the Indian Railway has conducted a trial run on roll of, that is known as RoRo service? North Eastern Railways, Southern Railways, North Central Railways, Western Railways. Correct answer is Southern Railways. The Southern Railway Zone has recently conducted the trial run of roll-on-roll or RoRo service in the Tokur-Shonur section of the Palakkad division. Then last question. Where is the All India Institute of Ayurveda or AIIA located? Mumbai, Varanasi, New Delhi, Ahmedabad. Correct answer is New Delhi. So that is about today's questions. So thank you for watching this video. If you have any doubt, means you can ask in comment sections. So you can share with your friends also, and you please click the like button. So thank you.